My name is Karen Holly, and it gives me great pleasure to welcome you to Care and Support West monthly webinar. We have today's session is being recorded and will be uploaded onto Care and Support West platform, Circle platform, which I recommend you go and have a look at if you've not already done so. There's a little tour that you can take and just have a look. You're very welcome to go and see. Back to today. We have an excellent programme today, which I hope you will find interesting and useful. It's designed to help you, anybody supporting people living with dementia. And to introduce today's speakers, we have Isabel Jones from Alive. I hope everybody knows Alive. If you don't, then look them up. Honestly, fantastic organisation. Then we have John Williams. John is from the Avon and Wiltshire Mental Health Partnership Trust and does some fantastic work for mental health, basically, don't you, John? So appreciate it. And then we have Steve Shelley-King from another organisation, which is a fantastic organisation called Dementia Carers. So I'm going to stop talking and I'm going to hand the floor to our first presenter, Isabel. Over to you.
Thank you. Well, good morning, everyone. Let me just share my slides for a minute. Hopefully that's coming over. Can everyone see it?
Coming through. It's coming through.
It's always a bit slow. It's a Thursday, isn't it? But brilliant. So if anyone, I can't see anyone now. So if anyone has got any questions, Karen, can you just kind of, because I'm quite happy for people to put their hand up while we're going through or whatever. But if you could just let me know if someone asks a question, because I can't see. If that's okay.
Absolutely.
Brilliant. So just a little bit about us. So some of you might know us, some of you might not, but we're a small Bristol-based charity. We're absolutely dedicated to enriching the lives of older people and supporting those who are caring for them. So we've worked with care homes for the last 16 years since we were started by an amazing man called Tim Lloyd-Yates. So we deliver a range of meaningful activity sessions within care homes. We also train staff, care staff and carers at home to understand kind of the need for engagement, for activity, and how to deliver that to the absolute best, really. We do provide some resources on our website. And then we also try and connect communities and individuals through a lot of intergenerational work, random projects that we love doing that are full of creativity. For example, we've made beer this year. So we try and do things differently and bring creative kind of thought as much as we can. And then we're so passionate about older people and the care sector that we try and speak up and try and change where we can. We're quite a strange organisation in that we deliver every day. We speak to all members of staff, we speak to residents, but yet we also talk to people who make those decisions. So we're kind of grassroots and sort of top level as well. So we feel we're kind of in a reasonably privileged position to make a difference, and that's what we try and do. So I'm here to talk about kind of stimulation, about activity, engagement. And for me, this picture just sums up what really good quality engagement can be and the joy that it can bring. So this was Lily. So Lily was in a care home in North Bristol, and she loved intergenerational work. That was her thing. Every Tuesday, the children from the school would come in. And she was really worried the funding was dropping off. And this photo was taken the minute that we found out that the funding was there. We told Lily that the children were still coming in. But what I love particularly about this photo is the relationship between her and her manager. So good quality engagement brings joy to the resident, but it also brings joy to staff. And you can see that wonderful relationship that they've got together. And it changes a home and it changes an atmosphere when that relationship and that joy is there. And this is one of my favourite photos as well. Thank you. Just that kind of intergenerational connection and the joy you can see it brings everybody, and the just knowing what people want. Talking about kind of what people want and the importance of activity, I just wanted to share kind of my why, I suppose, why I got involved. And for me, it just sums up why we need good stimulation and activity. So this is my great aunt. She was Bobby to me, Dr. Joan Franklin Adams. She trained in the late 1930s, and she's quite old, as a doctor, one of the only female doctors in the UK at the time. And she then went on to be a pioneer in paediatric community medicine in many war-torn environments. So she went to Greece, she went to Afghanistan, she worked in Korea, and she would set up children's camps, and she was responsible for that. She worked for Save the Children, but she was one of these people that was absolutely inspirational, determined. Her life was full of service. That's what she did. And not many people can say that when their great aunt came to stay with them in her 70s, that I used to go tree climbing with her. We used to go for 5K runs. I was a runner and I loved it. But she would tell me her stories of the difference that she'd made to people, the lives that she'd changed, the children that she'd supported, that she'd saved. And she said it with so much passion, and that I could see what she got out of helping people. But we watched her change. We watched her develop dementia. And because she didn't have a wider family, we had, she had nieces and nephews, but she didn't have any children. She'd never married. So she went into a care home quite early because of issues with safeguarding, effectively. And, it was tricky. The care staff really struggled because the way she was, she needed to know that people were, but she was absolutely passionate about people kind of equality and equity and ensuring that people had the right things. And if she saw people with two things or similar things, she'd actually go in and take it and give it to someone else. So she was described, unfortunately, as a thief, as a wanderer, as difficult, as challenging. She had to walk. She was always incredibly fit. And we worked out with the care home that actually if she was going through the sitting room, she was going to Greece. And if she was going through the kitchen, she was going back to North Korea. So she wanted to go back to being a doctor, to making a difference, because that's what made her tick. So we talked to the care staff and went, how can we help this? How can we stop her escaping? How can we encourage her to walk? So we talked, and the care staff said, well, actually, we think we can help her. So we made two different doctors' bags, and we enabled them, one for Greece and one for North Korea. And she would take those. And after that, and after she was given permission and they made the home safe for her, she was different. And she was allowed to go. She was happy. And the staff noticed such a difference in her. And for me, that just it was a light bulb moment that actually, we need to see that person and not the condition. We need to acknowledge that actually that person is still the same person that's made that difference for the whole of their life. And actually, activity and engagement, we need to know their history. We need to tell their life stories, understand what those triggers actually are and what is causing that behaviour. And we need to adapt our activity and our communication to suit that individual. And that's the difference that we saw in my aunt. And it was incredible. It was so marked. And it was a long time ago, but I still tell the story because it's still so relevant and so important to say. So obviously, with engagement and activity, Tom Kitwood came up with some fantastic ideas. He was so behind, a leader in terms of how we see activity and engagement and person-centered care. And he said that, you've got inclusion, comfort, identity, occupation, and attachment. And in the middle is love. Going back to my Auntie Bobby, her comfort was helping people. Her identity was a doctor. Her occupation was saving people. And, her attachment, it was all tied up with that. And in that she had love. And, Tom Kitwood said, if one of those is missing with us as individuals, and we know what it's like, you might not feel that your job's going particularly well at the moment. And that makes us feel unhappy and unsure. And with older people, we know that we see faster deterioration. We see disengagement, boredom. There's an increased risk of falls as well. An increase in social isolation, depression, distress, and reliance on medication. So we need to think about that when we're planning our activity. Does it include all of these petals effectively? And will it end up with that person feeling loved and attached and sort of heard? So the benefits of really good quality activity. We know that residents' wellbeing improves hugely when we have good engagement. Staff wellbeing does too. They see the residents are happy. They're loving what they do. And, we've seen some brilliant things happen in care homes where actually a member of staff has got a particular hobby. They might not be an activities coordinator, but they're asked to share their love and their story and their skills with the residents, and it works. And it's great to be able to bring yourself to work and share that. It really helps with staff retention because people are happy in their jobs. They can see their residents are happy, and they get that sense of satisfaction. Perhaps we've got less paperwork. That was something that someone pointed out to me. We've got good family relations, improved inspection outcomes because you're showing a really good quality level of engagement and activity, which has those knock-on effects. It's a better reputation in terms of a care home because people can see the level of engagement and activity that you're doing. I once spoke to a manager of a care home and I asked her, because they put all their activity, small and big, on social media. And she said, I don't worry. I don't have a marketing budget because she said, my activity does my marketing for me. She said, because I can show the smiles and the joy and where we're taking people and what we're doing. And she said that for me, that's the best thing ever. And she said, I'm never short of beds. I never have an empty bed because people can see the joy, the engagement, the connection I have with my residents, and that helps. So what is kind of, stimulation or meaningful engagement? It needs to be person-centered. It absolutely needs to revolve around that person. It needs to be relevant to that person. It needs to be something that they're kind of engaged with, that they've done before, perhaps, or that that they love doing, or they've said they want to do. We need to know people's life stories. We need to know what they've done before, what they've enjoyed, what they want to do, and perhaps what they don't want to do. I remember doing intergenerational with a particular home in Portishead. And there was one lady and I went, oh, you're going to love this. We're going to bring the school in. She used to be a teacher. And she went, no, thank you very much. She said, I've worked with children all my life and I don't want them now. And it showed me that even though we've got life story, we need to check that people actually still want to do those things. And sometimes people want to try new things and different things. But also it needs to be at the right level for the individual. And we'll talk about this a little bit later. But that level can change, and it's important that we adapt and we change according, for those people in our care. And it draws on the nature of the individual and who they are. And we need to give people a choice. It needs to be something that they want to do. They don't have to do things. My dad, his joy of activity, believe it or not, he's 83 and he codes. He's been a computer programmer all his life, an engineer. And he's very unsocial. And he said to me, if I end up in a care home and you make me go and play bingo at 2:00 in the afternoon, he said, I'll be miserable. He said, what I will want to do is either read my newspaper or go on my computer or my iPad. And for some people, they might think that's very, it's not what he should be doing. But that's what he's chosen to do. And that's what he needs to do. And it needs to have purpose and occupation. And that might not necessarily, our purpose and occupation might be different. And it might not just be doing flower arranging or something like that. It might be cleaning the house or doing something different. But what we need to see is that it brings joy. And that's the most important thing. And that joy might be slightly different to different people. And that's why we need to know our residents as we do. So the types of engagement, types of stimulation and activity that we need to see, well, we've kind of come up with sort of 6 different types. We've got physical engagement. So we need to do exercise. We need to be moving. We also need to think about cognitive and kind of, how does that make our brain? Does it stretch our brain? Does it make us think? Does it make us remember things? Does it make us learn new things as well? Is it social? That's really important. And actually some things can be more social than ever. And, it doesn't have to be an amazing kind of Butlin style activity. Just sitting down with someone is really important. Sensory is also important, particularly as the dementia progresses. Are people able to touch and feel and to hear? Think about all the different types of senses. Is it creative? Does it make someone happy? And also some people, their engagement needs to be spiritual. Everybody is different. And that's why we talked about the importance of knowing people. For some people, their activity on a Sunday will be a church service. So do we need to take them to the church? Or do we need to ensure there's a safe place for them to pray every day? Are there certain types of things that they like to do that they did? So it's important that we know people that well. Simple picture of dominoes, really simple game that everyone kind of thinks, oh, really? We were at a meeting centre and we played dominoes for 2 hours and they loved it. And bizarrely enough, it ticks most of those boxes that we've just talked about. The social element of it is huge. They got incredibly competitive. It was hysterical. So the social engagement was huge. We tried it in different teams. Cognitive, we had to think, we had to count, we had to look at the numbers. It was physical because people were reaching, and these were people with limited mobility. And, we encouraged them. Some people dropped them, encouraged them to pick them up. So simple games can actually really stretch people. And so we need to think about how it reaches. It wasn't quite so creative or not particularly spiritual, but actually, and for some of our groups, for those who've got Caribbean heritage, dominoes is incredibly important. And again, we spend hours playing it with them. So sometimes the simple things can be just as effective. And sometimes it's, the everyday matters. For some people, they want to cook, they want to clean, they want to lay tables, they want to help with the laundry, they want to fold, they want to put the socks away. Sometimes we think when people come into care homes, actually, we shouldn't be doing it. They shouldn't be doing that. Actually, for some people, they should, because that was their life. That's what they like. They don't want to sit there and do nothing. I'm a doer, and I'd hate to think the fact I was sitting there. I don't particularly like cleaning, but actually, I'd love to be involved in decorating and, gardening, that kind of thing. So people can feel the everyday. We're not, and one of the care homes I went into, we work in someone's home. And as part of someone's home is they want to be a part of that and part of the organisation and part of the running of that home. And it's important. Not everybody wants to, but actually some people would love to. And it may, we will still have to do the jobs. We will still have to do things. But actually allowing someone just to come and help you dust a corridor is really important. And it gives them that purpose and that occupation and that sense of achievement and a sense of still being wanted and being useful. Because activity is not just, 2:00 in the afternoon. Activity is all day, every day. And it doesn't just have to be, things that we think. So, exercise or anything like that. Activity and engagement and purpose are jobs effectively. And that's just as important. And I want to say that everyone matters. Very often in care homes, we've just got, it's not just the job of an activity coordinator. Everybody should be involved in that element of engagement and stimulation. A whole home approach is needed. We need management to absolutely show the importance of engagement and activity. And part of that should be that it's well resourced, that we get families involved. We find out, have families got talents that they want to come and lead an activity? And it's, it's important that we tell, we show people that they're listened to. And we know it's hard when time is an issue, but actually having those routines embedded and ensuring agency staff know who our residents are is equally important, because for someone, it might help them, when they're doing personal care, that if you sing Elvis, because that's actually, they're the person that they've loved and they've danced to all their life. Can you help that? Just 5 minutes of that little bit of engagement and activity, which it's stimulation, will help in that day-to-day task. And it's important that everybody knows that. And equally, environment matters. The environment of our care homes is so important in terms of stimulation and activity. Is it stimulating? Do people have opportunities to pick up things, to look at things? Are there books out? Are there, is there easy access to things that they would want to do? Is it homely? Is it easily accessible? Can they find those things? Does it promote that kind of independence? Can someone make a cup of tea on their own with support? Is that possible? And again, does it encourage social interaction? And again, I quite like this layout because you can see that, there's a good, it looks homely, it looks normal, but yet you've got different social areas. So if someone wants to be on their own and sit on their iPad in the corner, they can. If other people want to be in a group, they can. It gives people that opportunity. And equally, for us as an organisation that does a lot of gardening, can you access outside? And for us, this is so important. Very often, people don't know where their coats are. They don't know how to get out, or it's, the door's blocked, or there's a chair in front of the door. Can people access outside easily? Or is there chairs by the window? because again, that's something really simple. People could just sit and just watch birds in the garden or see people outside. So we need to think about that environment and what it means to people, and is it stimulating, and does it make it happy? Does it make them happy? Simple cup of tea. For us, we have a cup of tea every day. We get a chance to sit down. Very often we have a tea round, but actually, is someone sitting and having a proper cup of tea with someone? Think about that. For a resident, actually having 10 minutes of meaningful conversation, maybe about their grandchildren, maybe about, a carer's life, maybe about their children. It's really important that that stimulation is there through that social engagement. I know, for example, one of the carers, just in my in one of my meeting centres, I went in one day. I'd had a very hard day. I was going through some family difficulties with my children, and I walked in one day. I'd had a very difficult day the day before, thinking I was masking. It was fine, and the carer called me over, and she said, "There's something wrong. I know you." And I explained to her what had happened, and she used to be a social worker, so she sat me down. We looked after her husband. Someone else looked after her husband, and we sat for half an hour. And she supported me, and she counselled me. And the advice she gave me that day helped me so much. And she said, "You've given me a purpose again. You've made me feel." I used to be a social worker. I used to support people who had issues, and it was brilliant. And so we need to remember that actually bringing ourselves to work is just as important, and provide that engagement and that stimulation to some of our residents. And again, this something simple. The lady on the right, she lives in the care home, and her husband, we asked what do you miss? And he went, "I miss having a romantic dinner with my wife. I don't get that. It's always so busy. I never really come in for lunch or dinner." So we organised to have a romantic meal for the two of them. There wasn't a dryer in the house. Something really simple, but again, for them, that activity and that stimulation was, so good for their well-being, so good for their connection, and so good for the home. But just something really simple, and we just asked. So in terms of a dementia journey and activity, I kind of alluded it a little bit earlier. With dementia, different stages of dementia need different things, and activity will not stay the same. So it's so important that we amend and we change. People's stages, people might develop, their dementia might progress when they're with you in the care home. So you might need to shorten the sessions, you might need to have more familiar tasks, and you might need to look for a different kind of interaction and connection with someone where maybe they would have said it's fantastic. They might not be able to say that anymore, but they might be absolutely beaming from ear to ear. So we need to develop that activity. So previously, when they might have dug in the garden, they might just do simple planting. They might go from planting to making lavender bags, and they might go to making lavender bags to actually just smelling lavender and playing with lavender in a sensory way. So it's important that we're still doing the same things. We are still giving them the same kind of interaction and we know that they still love doing it, but actually we're just changing the level at which they can achieve that joy and that sense. Pace and place are equally very important. It's not about what people can't do, but what can you do. If someone wants to make a cup of tea, they might not be able to pour the boiling water, but they might be able to pour the milk. So let's try and help them to do that and to achieve that. We still need to give people the chances to do their favourite activity and adapt. So linking back to what I've just said about the gardening. But like in terms of football, people might not be playing football anymore, but they might want to talk about it. They might want to watch it. And also something's really important is repetition is fine. And actually, it's quite important with what we found. It's okay to repeat things. Sometimes we feel silence might be awkward, or repeating an activity might not be the best thing, but it's okay. And people often like to do that because they might remember how they did it before and they can do it again. So it might increase that sense of achievement. So I just want to share this story a little bit. This is Joe. So he was in a care home in central Bristol, and he joined the care home, and he was blind, and he was non-verbal. And it was really hard for an activity team to kind of support him. And they didn't, and talking to the family, we kind of, well, what happened is we had things out on the table, and we were handing Joe things, and just to see if he kind of explained what the actual kind of item was, because we were trying to find out what people liked. We handed him lots of different things, but the thing that he loved the most was a cricket bat. And he held that cricket bat for about half an hour and he stroked it. And we obviously realised there was a connection with cricket. So we spoke to his family and it found out that actually he had been one of the first players of colour in Bristol to play for a normal Bristol cricket team. And it was incredible. He'd made a huge leap in terms of that and in terms of integration. And what we did do, he had 3 months in the care home, but we supported the care staff. They didn't know about Test Match Special and about the fact that you could listen to cricket on the radio. And he listened to that for the last 3 months of his life. And it just brought him so much joy to have that love of something that, something that had been a major love of his for all his life. So in terms of measuring impact and activity, it's important. Well, we can look at things like mood tracking, the Edinburgh and Warwick scale. We use something called arts observations again, which is a really good way of showing what people were at the beginning and how their mood has lightened and how they're interacting. And that can be anything from, just showing a smile. We can look at participation. How many people are engaging with you? Have a look in your home. If you're increasing the activity, are the falls decreasing? Is the need for medication, is that decreasing? Look at feedback. Are people enjoying it? Talk to staff, talk to residents and talk to family. It's important that we try, so that when CQC are there, that you can show that actually the level of impact that you're getting from your activity. I want to talk just very slightly about co-production because again, this, it kind of fits in with everything I've said. So this is a scale that we're starting with, which is done to and done with. So I'd like you to think about where are you as a home on that? Do you inform people you are going to do this kind of activity, or do you consult? Do you involve them in that decision making? Do you collaborate? Do you talk to them? Do you find out? And actually, do you then adapt and say, well, that didn't go particularly well, or they didn't particularly enjoy that, and they'll go, well, maybe I want to try something else. So it's important, not just about evolving, it's about collaboration and change and development. And then empowering. And I completely get that actually people living with dementia, sometimes it's hard to completely empower and to get them to lead activity because with the nature potentially of where they are on their journey, it's not possible. But that's something that potentially we might aspire to. So I just want to leave you with an action plan. Are you auditing your level of engagement and activity and stimulation? Are you looking at where the good things are? We can always come and help you with that if you want to. Have you got champions in your home who champion activity? And that's not just an activity coordinator. Is it the handyman who's brilliant with someone who can really talk to the men? Is it, a receptionist? Is it your hairdresser? Think about who can really champion that engagement and get them to do it. Identify training needs. Find out who in your home needs a little bit of help with engagement and stimulation. And then develop that engagement plan. Develop a new weekly rhythm. Actually ensure that you've got regular reviews and ensure co-production is absolutely through the middle of it. And this is Maya Angelou, and I love this. And I love the joy on those two there as they're watering really simply in the garden. She said that people will forget what you said, people will forget what you did, but people will never forget how you made them feel. And good quality engagement and stimulation brings joy and makes people happy. So it's so important that within the care industry, we are doing that for people. So thank you for listening. And if you need anything or need any training needs or anything, please get in contact. But thank you very much.
Wow. Lizzie, that was fantastic. Working with people who have this horrible illness, I mean, you can give so much joy, and I've jotted down so much. But before I speak, has anybody got any questions for Isabel? Anybody want to put the raise their hands or just shout out if you've got a question, or if I can't see anything in the no, John?
Yeah, Isabel, I was going to ask, how difficult is it to get off the ground, that intergenerational work that you talked about at the beginning of the show?
It can be. It depends. Sometimes it can be really simple. So sometimes it's just engaging with a local school. It can be engaging with your local like mother and toddler group and bringing them in. And sometimes it can just be as simple as encouraging family members to bring in their young ones and not to be frightened to bring them in, actually. But yeah, we do lots so we can help people and support people in that. But it's magical. And Most people love
Yeah.
it. Not everyone does, but most people do. And what is important in that intergenerational is think about the ages. Some people love babies and some people love people who are 18, 19, 20. So actually intergenerational doesn't just have to mean small people either.
Great, thank you.
All right, Richard first, then Heather.
Thanks, Karen. Izzy, thank you. It's always a pleasure to hear you speak about this stuff, and thank you for sharing those stories, actually, because those are so important. And I think if anyone knows Izzy well, hearing that just makes us realise how driven she is and how Alive is such an important organisation for us as care providers. I say that from experience. I'm sitting here with Care and Sport West above me now, but I've been a provider in South Doss for 15 years, run 3 homes. So I've always been an advocate for getting Alive in and helping the team. And that's what I was going to ask you about, Izzy, is how could you support a home where you've got 1 or 2 people who are really driven to do this and really get it, but then the whole team has to be engaged with this? So I think I'd be interested, some of us might be interested to hear about how you can help the manager or the activities coordinator bring it to everybody, because it doesn't always happen that way, does it?
No, it doesn't, and we know how hard that can be. And I think it's, we've done training, we've done coaching with people. So actually, we then kind of increase the kind of level that it goes out, and people get that. I think it's by showing people as well the impact it has on the residents. And I think it's that training and that support to people that actually, people's lives and care staff's lives are easier if we engage more. And it's about that, and it can be really, really tricky. And it's about engaging people to share their stories as well, if people are happy to do that. And it's okay to bring yourself to work.
I think it's infectious as well. It
is.
I mean, I know from experience, because I know I've engaged with you in a nursing home, and I think when you come into the nursing home, I think you bring so much joy and so much activity that it is infectious, and it has a knock-on effect.
Yeah.
Heather, your turn. You got a question?
Yeah, sorry, I was just going to say about, I was
Oh.
just going to refer back to the intergenerational aspect that you were talking about. We're really lucky. We're next door to a children's day nursery, so they come over every week, and they just come in small numbers, and they're ranging from sort of 2 up until about 4, and that works with a small group of people, because if you're doing an activity with them together, you're not being judged by the little ones, and if you can't hold things properly, neither can they. So it's kind of all on a level field. But we also employ younger people as our juniors, and some of them come in. So we had one guy come in who's actually left us, but he's gone to school in China. So he came and did speaking in Cantonese and writing Chinese, and just sort of explained to people what he was doing there. And that was lovely, because there were some of the residents who'd lived in China or Hong Kong, and they could share that, and it was really interesting for them. And the same, you've got children that are doing their Duke of Edinburgh, that they come and do some voluntary work. There's loads of different ways of involving different groups in. We've had the music department at the local school, they've come in and done concerts because it's good for them, and we've had dance groups come in, all sorts of stuff that you can get intergenerational work on board. I just thought I'd mention that.
Fabulous. Well done.
It does take a bit of work, and I think that's important, and I think people sometimes, but it can be hard because it's getting those relationships, and I think I think it is so important to do.
Thank you. I wrote down some takeaway words: engagement, how, adapt, and stimulation. I think that's key to everything. Right. If there's no more questions, I think we should move on to our next speaker. John, over to you.
Yeah, morning all. I'll not talk for very long. I've basically just come to introduce a learning resource that's been made available by colleagues in Gloucester. So just a bit of background. Izzy and I came to speak to this group, I think in November last year, and we were both talking about training opportunities. So Izzy's organisation does some training with a dementia suit. Across BNSSG, we're trying to roll out a dementia model of learning to as many partners as we possibly can. And about a month before that meeting, I'd been up to the launch of the training resource I'm about to talk about up in Gloucester. So one of the key drivers behind this resource is Steve, who's on the call. Didn't know he's attending today. And it's a resource that was developed by a number of different partners across Gloucester. But I think everybody involved has been touched by dementia in some way or other. So, for example, the producer of the videos has worked in television for many, many years, but one of her parents had a dementia. So she got hooked up with the partners and they've developed these videos. It's really inspirational. It's really courageous. It's a difficult piece of work, which is it's hard to get across the line in terms of ethics and consent. But it really is inspirational, and it's a resource that will complement anything that you've got. So everything that Izzy's just talked about, you'll hear about in these videos in terms of personalisation, care planning, getting to know the person. It's all in there. So 11 videos in total. I'm just going to show you the introductory video, and then Steve can take any questions that you got. So Karen and I practiced. Karen and I so the other thing I didn't mention, it's an extremely generous offer as well. So God knows how much resource has gone into this. Gloucester have made this available across the country, so it's available to everybody. I've been ringing this bell in as many meetings as I've been going to. It's a really generous offer from the people who produced it. Okay, so and for free. I'm trying not to say for free. It's available to everybody, no cost. So Karen and I practiced this yesterday. Hopefully we'll get it on screen with sound. And I'll give it a go now. This is the introductory video. It's about 5 minutes, and I'll probably say everything I was going to say in a better way.
Coming through. Can't hear it. Yes, can hear it.
We look at our demographics and we can see that we have an increase of 50% in over 85s in Gloucestershire in the next 10 years, and then 35% in the following 10 years.
Statistics predict that many of us will need care in our later years. Personal stories remind us of what that actually means.
It's having personal experience of looking after my mum with dementia. I'm so passionate about supporting people to put the person at the centre and give the staff the training and skills to make sure they provide the best outcomes for those individuals.
I've got a friend, a very dear friend, who's only 70, who's had dementia for 2 years now, and I've just seen her life being transformed, and I can see that there's a real need to grow understanding around how to give her the best life, how to get the right support for her, and to help her carers family.
This need is being answered in Gloucestershire through a collaboration led by the NHS Integrated Care Board and University, in partnership with Gloucestershire Health and Care Foundation Trust and County Council, to create an innovative series of training films for carers, showing footage gathered from 2 different care settings: Wentworth Court, a specialist dementia care home, and an extra care sheltered housing complex where people live pretty independently.
Welcome to Hanover Court. I'm Sharon, the estate manager, and we'll have a quick whistle-stop tour of the estate.
We're using a mixture of fixed cameras.
I should put it down too low. You might find it doesn't stay on the wall.
Filming with a cameraman, and exploring the use of technology to get a resident's eye view of their lives.
I'll just go home. Can you read that? Get crafty.
across Gloucestershire we have an existing dementia training education pathway, and these videos will really complement and support the team, the dementia education team, in upskilling the future workforce, the existing workforce, and seeing workers in action supporting a person with dementia, working alongside a person with dementia.
I think what's so exciting about this project is feeling that you have that opportunity to improve patient care for people with dementia in Gloucestershire, but also nationally as well.
I want a snapshot of what it's like to become fully engaged as a carer with people living with dementia, so that we can shine a light on how it could be done, how it should be done.
Nora, would you like me to turn your heating down a little bit? Do you think that would be a good idea?
Oh, no, I don't.
Well, I've turned your heating down. It was on 30. No wonder it's rather warm.
Yes, I'd never touched that. I really don't.
That's all right. It's yours. You can do what you want with it.
Well, if I wanted to touch it, yes, I would.
Getting permission to make this series has been a challenge.
It's not easy to film people who haven't got capacity, because you have to think about what their best interests are and what their wishes may be. If they did have capacity, is this a project they would like to be part of?
We've been working for the last 12 months, haven't we, on an ethical approval application, which obviously the university have said is a real exemplar.
God, it's so exciting. From those little seeds that we laid, I don't know, a year ago, just about a year ago.
This is the first of 10 films, made with love and respect for those who've agreed to share this glimpse into their lives. We all hope that it will make a really good training resource that will help improve care.
I think we're quite proud of what we do here, and we think we do it well. And no, like I said, we don't get it right all the time, but most of the time we do.
So I'm not going to stop sharing just yet. So I'll just show you the web page where the videos are attached to. So I think there's 11 videos in total, covering, well, all aspects of dementia care and the issues that people or caregivers encounter. And along with the videos, there are viewing guidance and also facilitator workshop prompts. So it really is a complete package that, as I said, will complement any packages that you've got or you are supplying in your care homes. As Steve said, it's free. It's available through a website called Pocket Medic, and Karen has the link to this, and she can share it with. There you go. Steve shared the link in the comments section there. I'll stop sharing there. And I guess invite any questions. So one of the videos, for example, so it doesn't show how things should be. Again, it's really courageous. It shows how things could be done better as well. So in one of the videos, there's a film taken by one of the cameras which are attached to the wall, where a gentleman who used to be a truck driver worked on the ferries, going back and forth on his lorry. He thought he was in Go on, Steve, you got your hand up.
Sorry, John, I didn't want to interrupt your bit there. You carry on and I'll come in. Sorry.
So yeah, there's a video of a guy late at night trying to break out of the care home that he's living in. He believes he's on a ferry, and he's trying to save all of the passengers. So the actual home manager comes in, says, "Stop shouting, come up here." And then someone comes in a little later and uses a different approach, very empathetical, relating directly with his experiences as a younger man, and manages to de-escalate that situation through kind of empathy and listening to what his needs are. So it's a really courageous piece of work, shows people warts and all, uses examples of how people can learn from their experiences, and talks to that directly. So I'll stop talking. If anybody has any questions, now's the time to ask.
There's no comment other than Steve's link in the chat, but nobody's got their hand up at the moment, John. So do you want to carry on?
Well, I've not got anything else to say. As I've said, the introductory video I think says it all.
It does.
Alongside the videos there, underneath each video on the website, there's some like discussion points. So you might be using this as a kind of an informal teaching session with a small group of staff, or just want to watch it by yourself, or get colleagues to watch it by themselves. So then there's some kind of discussion points under each video, or thoughts, or things to think about, either prior to watching the video or after watching the video, and that just helps to enable some conversation. As John said, it is warts and all, so you will see not perfect practice. This is, I guess it shows the true reality of working in those kind of care environments. And as John has said several times, it would just hopefully would be helpful to enhance what are the any existing training that you guys receive, or interact with, as well. So yeah, so really good videos. I think the longest video is about 12 minutes, so they're not long videos, and it was about a 2-year piece of work, so it was really massive, and yeah, long time to get there, but we did get there. And yeah, so they're out there and available. Feedback so far has been really positive across the country, and the families that were involved in the videos, yes, they said yes at the start, but they were able to watch all of the clips prior to them being kind of produced and signed off, and families were still really on board with allowing their loved one, to be involved in the video, whatever the scenario. As John described, the one chap does get quite distressed in one of the videos. Nora, the lady who lives in her own flat, at some point we see her have quite a bad fall, but families wanted that to be in there to sort of really show the reality of the lived experience of a person with a dementia. So so please do watch them and make use of them.
I think they're brilliant, and the fact that they're free, and as John said, very, very generous of Gloucester. Richard has put a comment, we don't always get it right. It's probably the best line, and the reality. That's so true, Richard. So true. Okay, well, I encourage everybody to take the link. If you don't have the link, or if you forget to, Care and Support West will have them up on the Circle platform, so for you to be able to have a look at again at your leisure. So if there's no more questions for John, I'm going to hand the floor to Steve. Your turn, Steve.
Thank you, Karen. And I've got my colleague Satya with me as well, so she's going to do a bit of a double act for the first few slides. So welcome, Satya. If you want to introduce yourself.
Of course, thank you. Well, thanks everyone for having us today. I work with Dementia Carers Count. I'm their corporate partnerships manager, and I have the great pleasure of working with Steve on the training side of our charity. So I thought I would just introduce the charity and talk a little bit about what we do and how we help people, and then hand over to Steve to deliver a little mini training session for you today on communication strategies and a little bit on behaviours that challenge, because that was by far the most requested topic. So a little bit about Dementia Carers Count. We are a small national charity. We deliver our services remotely, and we exist to support unpaid family carers of those with dementia. So we put out an annual survey every year, and one of the things that we hear all the time is that carers want a single point of contact rather than being bounced around from GP to social services to memory assessment to everywhere. So we aim to provide that as much as we can. So carers can call our carers support line, and that's open 5 days a week. And with that, they can get emotional support. So we can give them professional counselling for as long as they need it, really in depth, and a lot of the time exploring kind of family dynamics or resilience or living grief or any of those things. And we can also help with the practical issues and advice as well. So that might be form filling out, particularly for those who are digitally excluded or they find form filling online quite tricky. We can help fill out assessments for carers allowance or council tax reduction, we've had a really good track record of improving household income for carers. Last year we hit the over £1 million of additional income freed up, or I think we helped 1,500 carers all year. So the average was, something really, really positive for people, because of course we know caring has a big financial cost as well as an emotional one as well. We help family carers with transitions, particularly into care settings, or when taking on some help from outside, from paid staff, and how the person with dementia might not want, but having those difficult conversations. That's something that we do a lot as well. And then we also run online peer support groups to facilitate carers getting to know each other and just having someone who understands and can listen, and kind of families supporting each other. So that's the carer support service. So Steve, if you can flick onto the next slide for me, please, that'd be great. Thank you. So our carer support line is there. So you can see the number. I'm happy to share that after, if any of you do have family carers in your network that might benefit from a bit of emotional support or practical advice. We've also got our website, which is a fantastic resource, and it has lots of information, articles, blog posts, links to videos, help with environmental factors like kind of decorations or plates or eating or drinking or temperature or any of those things that people may not know about that can help their person with dementia. So yeah, the website's a great resource as well. And then we've got the online peer support groups, which are running bi-weekly at the moment, and we're encouraging people to jump onto the waiting list for the next round. So that's our support for family carers. Thank you, Steve. And then so as my role as the partnerships manager is to partner with businesses and care providers, and that is part of what funds those carer support service. So I do a lot of work with businesses in all sectors to support their staff who are carers. In our most recent survey, we found that 1 in 5, or just over, so more than 1 in 5 carers are quitting their jobs or having to give up work in order to provide dementia care. So we want to be working with the employers that are of those carers to support them at work, so that they get that little bit of extra wraparound care. So we've recently done a series of webinars and dementia awareness training with, for example, a gaming company. We've done it with a high street bank, with an insurance firm, because of course so many of us have experience with dementia. It's like it affects everyone in every sector. And then we also offer clinical sessions and training as well. So we've got tier 1 dementia training, tier 2 dementia training, both CPD accredited, and we can do those virtually or in person. We do have a simulation training. It's not as not as techy as Isabel's incredible dementia suit. We don't have one of those. We use kind of gloves and glasses and other things, and that tends to be delivered with a tier 2. So it's like a bit of a joint package. The webinars have been really, really popular. It's something that I introduced last year, and it's kind of modules of the tier 1 and tier 2 delivered just as a standalone for staff, because people have such differing levels of dementia training, and we see that all the time. So this is why we wanted to be here today and deliver one of our webinars to you guys, so that you can kind of see what they're like. I think that's it from me.
Thank you, Satya. So hi again, everyone. So this is just a bit of a bite-size demonstration really of the training that's offered through Dementia Carers Count, and I think we'll share the slides after today's session as well for those, so the contact details etc will all be on the slides. But in today's session we're going to think about how dementia can affect language and communication. We're also going to look at strategies to help establish effective and meaningful interactions with people, and again, I guess coming after Isabel, where we heard about the great work that they're doing across organisations, just hopefully enhance what we've heard already. And then we're also going to touch on kind of this concept of behaviours that challenge, sometimes referred to as challenger behaviour or distress behaviour. Yeah, hopefully this will be useful. So I guess first things first, and I'm sure a lot of you or all of you would know this already, but dementia is not just about memory. And that's really important factor to remember, because when I'm speaking to care providers or when I'm speaking to families, regularly they just want to focus on the memory, and they haven't given thought maybe to sort of the wider symptoms that people will experience when they develop a dementia, and they range. As it's the brain is a massive, complicated organ of the body, and it obviously controls everything. And with dementia, we know that cells are dying off. Changes in the brain are happening. So as time progresses with that person's dementia, we know that will be more sort of global changes across the whole brain. So so we will expect people to have difficulties with concentration and attention difficulties, difficulties with managing everyday tasks. That might be washing and dressing, that might be, eating a meal, drinking a drink, or managing finances maybe. Changes to walking, the person's, they're changing their ability to mobilize or to transfer, getting up and down from the chair, or perhaps, sliding from the chair to the wheelchair, maybe with support. The person's will also have changes with their taste, their chewing ability, and also develop some swallowing difficulties, particularly as the disease progresses. Disorientation to time and place. Again, perhaps one of the more obvious symptoms for people. People will also have difficulty with control, planning and organising. So perhaps planning a journey, or organising, a doctor's appointment maybe, or just organising themselves in their place. Getting around their home, navigating around their own environment. Difficulty managing, regulating emotions. Visual and perceptual problems, and also communication difficulties. So the breadth of symptoms that we see with the dementia, are really wide. And as a real focus, it's not just about memory, and that's really important for us to kind of ensure that everybody is aware of that. Because so again, sometimes in clinics, when I see sort of families or people who are come in for memory assessment, they'll say, well, actually memory is absolutely fine, I've got no problems there. But as we go through that assessment or that discussion, we're really kind of teasing out all those other symptoms, all those other changes that people have noticed, over that period of time. So what can go wrong? So thinking about I guess communication. So a person with dementia will have some expressive difficulty, so that ability to express themselves. So that changes with thinking about what they want to say or remembering the right words, speaking or producing words and full sentences, saying what they want to say in socially appropriate ways, interacting with others, and maybe writing as well. So you can see that you probably know residents or people that you support, and you've noticed these symptoms, and you've perhaps noticed that change as well over time. Perhaps that, or what's that? Oh, can I have a cup of or what's that again? Oh, and sometimes we might have to think, is it right to prompt? Is it right for us to try and guess, what they're trying to say? And sometimes it is. Sometimes that is helpful. But obviously trying to be supportive and person-led as much as possible when we're kind of supporting people who maybe have difficulties with expressing themselves, is a really important factor. And then also that receptive difficulty, so receiving information back. So person will have difficulty with understanding or sometimes have difficulty with understanding what's being said, maybe following what's happening on the television or going on around them. Difficulty with instructions, also taking on any advice that's given, and that's really important for us to think. So when we're going to support the person with a dementia, it's not morning, here's to support you with a wash, then we're gonna have breakfast, then we're gonna pop out and go for a walk around the garden, or we've got that lovely activities coordinator popping in a bit later on to do some games with us. So that's obviously far too much information. That person will be overloaded with information there. So it's about kind of breaking that down into simpler steps, pausing as well, allowing time for that person to process that information. Person may also have difficulty with understanding gestures or body language. So, the way you approach a person may be perceived as quite aggressive, or, oh gosh, I'm really scared. What's that person trying to do to me? So it's also thinking about how we as staff, as people supporting people with a dementia, about our own approach. How can we do that better? How can we make that, more friendly? How can we get the best out of this person when we need to go over and have a chat to them or support with their meal maybe? And also a person will have difficulty or will develop difficulties with reading as well. And thinking about the person with a dementia and how they might feel with their difficulties, with perhaps not being able to find that right word. I know when sometimes I have word finding difficulties, and I know that I feel embarrassed, I feel stupid, I feel, gosh, what's wrong with me? So the person with dementia, they have exactly similar feelings. They might be able to say, "Oh, I'm feeling really embarrassed now," but internally, they'll be experiencing different emotions when faced with their own difficulties or changes to perhaps how they're able to communicate or manage in this world now. And sometimes that can lead to frustration. Sometimes that can lead to distress. And again, it's just being mindful of that. And okay, person's now distressed. How can we support them in this moment? What might we need to do to sort of make things easier for them or better for them, in this interaction, in this moment. I'm going to talk about sundowning, which some people might have heard, or all of you might have heard of. It's a concept related to changes, obviously, with brain abilities, and also changes with the person's perhaps ability to kind of understand routines or times of day maybe, but lots of things may impact and worsen maybe that episode of sundowning or cause that episode of sundowning. So we know that medications can cause worsening of the symptoms for a person with a dementia. So we might see that the person is becomes more forgetful or more confused or disorientated to time and place, maybe due to side effects of medications, or maybe an underlying health related problem. So some examples there of maybe an infection or pain, and sometimes we might refer to that as kind of delirium, and that's kind of a for people with dementia particularly, they're at high risk of getting delirium for many causes, but two of the more common causes for a delirium, so a sudden worsening of symptoms, can be pain and infections. Also, if a person misinterprets what's happening in the environment, so people leaving the space or people coming into the space, or the sound levels, the noise in that space, people with dementia will have difficulties with interpreting what's going on around them. So that may cause some upset, some distress, some behaviours that challenge. Poor lighting, shadows, reflections. So again, Isabel, on one of Isabel's slides, had a picture of kind of a lounge area. It was well set up. It offered different spaces for people. The lighting was pretty good. Lots of natural lights coming in. In that picture, particularly shadows, there weren't any shadows. I couldn't identify any reflective surfaces either. So it is thinking about the environment and how that may impact on a person. I know for me, there are times where I'm quite a really sociable, gregarious person, but there are times where I need my own space. I like my own company sometimes. So it is thinking about that for individuals, and a strong, again, back to Isabel, a strong focus on that kind of life history, that biography of the individual. How has that person liked to spend their time, in what sorts of environments, with lots of people, not with only a few people maybe. So environmental factors are really important when we're thinking about best support to people affected by dementia. People with dementia can develop hallucinations. They may also have some delusions, but again, they may also misinterpret what they think they can see. So thinking back to the shadows, if there's perhaps a shadow over in the corner, they may think that's a person. They may think that's somebody who's come to cause them harm. They may think that, oh gosh, that shadow over there, oh, hello over there. And, the word be thinking, oh gosh, are they having hallucinations? But sometimes that can just be misinterpretation about what's going on in the environment. Physical health issues, again, linked back to delirium, infections, pain as examples, really important. But then I guess any existing physical health conditions that the person have, it's about ensuring that they're well managed, that people are taking their medications or following the advice, because if not, we know that that can cause some fluctuations, some variations in a person's presentation. And, you know, again, thinking back to how the person might be feeling, if I'm in pain but not able to tell you I'm in pain, you know, how might I be presenting? I might be presenting as, you know, quite aggressive. I may be, you know, grimacing. I may have, you know, my fists, you know, tight. I may be telling people to get away from me, get away from me. So it's thinking about those visual cues we see for the person to sort of then we need to be that detective to think, okay, Steve's aggressive today. Steve's not really aggressive normally. What might be going on for Steve? Oh, actually, Steve had a fall yesterday. He did have a bit of bruising on his hip, but he was checked over. The hip isn't broken, but he might just have a bit of discomfort there. So what might we need to do about that? Anxiety and depression, you know, again, people with dementia will experience, you know, these conditions. You know, again, thinking about why they're getting anxious, why they're getting depressed, what do we need to do? What, again, environmental factors, what engagement, what can we do to help reduce that anxiety, help improve that mood? You know, do we need to get them reviewed by someone maybe? You know, do we need to, you know, I guess longer down the road, think about some potential treatments for that? But, you know, it's again, thinking about the here and now, what do we know about the person? What can we do to make things easier, reduce the anxiety for that individual? I regularly say at training now, so when I'm in a care home with dementia, if I'm kind of upset or angry or frustrated, you know, please put the Spice Girls on. That's really going to cheer up my mood. It's going to make me feel a lot better. It'll make me feel really connected. It will hit all those petals of Kitwood's flower that Isabel showed earlier on as well. So, so for me in my care plan, you know, please, you know, put Spice Girls on. But again, you'd only know that if you know about my life history. So again, that real strong focus and reminder about the importance of that. And of course, hunger, being tired, reduced activity or boredom, you know, they can all cause, you know, changes in a person's mood or presentation as well. I know if I'm tired, I'm definitely more grumpy the next day. You know, so again, it's a person with dementia, if they've not had a good night's sleep, you know, of course it's going to affect them because they're still a person. You know, so again, it's just sort of thinking about that and yeah, and thinking about kind of food, hydration, the person's, you know, continence needs. You know, good sleep is really important. And again, you know, as Isabel was kind of summarising, you know, the importance of activity, the importance of engagement, and how it can really help to, again, hit all those petals on the Kitwood flower around sort of person-centered care and, you know, really sort of making my life feel worthwhile because all those petals are being hit. So things we might see in practice. So as I've kind of already mentioned, so increased confusion or disorientation. I may be presenting as quite frustrated, agitated, and that might just be simple change, a slight change of tone in my voice. It might be that I'm starting to give you less eye contact, maybe. Aggression, it might be that I'm shouting or using swear words maybe, or even trying to hit out. Resistive to interventions can be quite a common symptom for people with dementia, particularly in that sort of kind of more moderate to advanced stage of disease, where, you know, where it's likely I'll really be unable to process perhaps, you know, what's being said to me, you know, why are you here? I don't understand this, you know, get away. You know, so it's, you know, what do we need to do as supporters of people with a dementia in those moments to help reduce that distress? Do we need to go out the room for a bit and come back again? Do I need to reintroduce myself as Steve the carer? Do I need to talk about things that are familiar to the person? Do I need to put Spice Girls on? So it's thinking about, we're presented with this behaviour, what can we do differently to try and reduce that behaviour? And if what we've implemented works once, it's likely to work regularly. So it's then thinking about sharing that information with colleagues, ensuring it's in a care plan to sort of best support that individual moving forward. We've already mentioned hallucinations, illusions, and paranoia. So again, they're valid, they're important. Hallucinations can sometimes be quite distressing for a person, but other times they can be quite reassuring for a person. So it's thinking about the impact the symptoms that we're seeing are having on that individual. Sometimes, quite often actually, people with dementia might ask for relatives who we don't know who they are, or that we know that they will be long past. So some examples there of mum or dad, or they might be asking for a particular pet, maybe. So again, it's thinking about what do we say in those moments. Do we say, "Oh, don't be silly, your mum's dead"? We wouldn't say that. We want to be more considered in our response. We want to be more consistent in our response. So it's kind of thinking about, what's the right thing to say for this person. Actually, they're asking about their mum. Let's talk about mum. Tell me about your mum. What was her name? What did she do for a living? How many children did she bring up? Lots of questions that it's likely the person with dementia will still be able to answer, or you'll know that information already. So you can say, oh yeah, your mum was called Gloria, and she worked as a nurse for many years, didn't she? Oh, how lovely! And your siblings, and here's a picture of mum. So it's again just thinking about, listening to what people are saying, but thinking about the meaning behind what the person is saying, then think about the strategy to then best support that individual. Restlessness with compelling sense, they're in the wrong place, so need to get a go home. Again, probably quite common, and of course this will vary from person to person, and it's due to lots of different individualized factors. So again, life history, personality, health conditions, relationships that are important to me. Lots of different factors will impact on how I present and how I am when distressed or hungry or tired. So we started to focus on a few strategies that might help, and again, they need to be person-centered. That's what's most important. So during the day, managing sundowning starts, as soon as the person gets up. So thinking about implementing regular routines, ensure that the person is active throughout the day. And I guess that's not just physically active, but also their brain is active. So, thinking about what activities we're offering, or why are we offering this activity? Actually, it's having really good benefits for this person, because we're seeing the change, it's creating a sense of joy, creating a sense of happiness. So we know for Steve, that's really important. Getting outside, fresh air, sunlight. Obviously, there's not much sunlight at the moment, but getting out in natural light, is really beneficial for people with dementia. Sometimes medication reviews are helpful, and most people have either a 6-monthly or 12-monthly medication review through their GP practice. So again, that's really important. Review by the GP might be helpful. Particularly if there's a sudden or rapid change in the person's presentation. Often that can indicate a delirium, which I've mentioned. So it's kind of thinking through, what might be the cause of this delirium. Is it pain? Is it an infection? Is it a change in their mental state, maybe? But, sudden and rapid change typically won't be a deterioration in their dementia. It's likely to be another underlying medical cause. So it's always definitely recommended to get that checked out. And incontinence assessments, again, can be quite tricky because often the assessment that's required, needs to try and, I guess, best manage or measure input of fluids and output of the fluid. So that can be tricky, particularly for people with dementia, particularly if they're already using different sort of continence pads or other. So again, that can be difficult, but another important factor to think about for the individual. Other strategies that might be helpful, so avoiding eating too late. So, you know, that's probably for a lot of people, but there might be some people actually they always had a later meal. So again, it's thinking about the person's life history and their biography, and thinking, you know, what's needed or what's important to this individual. You know, hunger is a really important factor that we need to ensure people aren't hungry. So it might just be a couple of snacks in the evening, maybe, or sometimes because people won't be so keen to eat big meals, it might just be regular snacking throughout the day is helpful. Drinking small amounts but often to stay hydrated is helpful. Avoiding stimulants later on in the day, so you know, it might be just, you know, agreeing with the person or their family, you know, but having decaf drinks in the, you know, afternoon, evening maybe, which can be helpful. Again, just, you know, to hopefully have a better nighttime routine. Be aware of your own stress. So even you know, people working in healthcare, you know, were impacted on. So if I've not had a very good night's sleep, I'm a bit more tired and obviously a bit cross with people, or I may get cross with people. So I have to really monitor that. So if I'm out supporting people with dementia or working in a care home or working on a hospital ward, you know, I really need to be aware of the factors that influence me and what is my mood like. How am I presenting myself today? Because if I don't think about that or monitor that, then that can easily be transferred over to a person with dementia. I may say the wrong thing. I may not use that warm, happy approach as I go towards you know, this person with dementia over here. I may have a bit of a stony face. I may not smile until I actually get to the person, but they would have picked up on those cues. So it's always thinking about, how am I presenting? How am I being perceived? What do I need to do differently? Because I know that people with dementia can't do things differently. It's what I need to do differently when supporting people. And another top tip for some people might be asking people not to visit after a certain time of day, because, you know, particularly if perhaps after that relative goes or that friend goes, you know, then the person becomes quite distressed. You know, why can't I go with them? I want to go with them. I need to get out of here. You know, why are you stopping me from going? So if we know mornings are a better time, then it might be suggesting to family, actually, where possible, could you lunch, you know, bit of negotiation there, maybe a bit of consideration, you know, what's best for the person with a dementia, you know, how can we ensure that they have a better time or episode after their loved ones have gone, maybe. You know, again, it's about them. It's not about us as staff or families in a lot of ways, but it's about the individual. Obviously, families are very, very important, and equally we need to support them. So when they leave, they may be upset, distressed. So it's about, you know, how can we support, you know, that son, that daughter, that husband, that wife, maybe, you know, after their visit, to ensure that they're doing okay, particularly if the visit hasn't gone very well for whatever reason. Validation, really important concept, and hopefully people are kind of aware of that. So when we are faced with a particular feeling or a particular mood or behavior, you know, it's really important to validate that person's feelings. You know, oh gosh, Steve, I'm really sorry that you're feeling a bit upset, or I'm really sorry, Steve, that you're feeling a bit angry. You know, I'm really sorry about that. You know, sometimes going out for a walk, or, you know, out for a drive, but I guess the importance there is activity, offering some activity. That might just be sitting down, having a cup of tea together and a chat for a few minutes. It might be press and play on the, you know, the CD for Spice Girls. You know, it might be just getting out in the fresh air, just for a walk around the garden, reminiscing maybe about life. But, you know, again, really important to sort of think about what's best for the individual. I briefly mentioned this earlier on, so simple sentences, simple instructions, you know, very helpful for people with dementia. And also that sort of 10-second rule. Now, 10 seconds, you know, that may not sound very long, but actually if you pause for 10 seconds, it feels like a very long time. So perhaps uncomfortable for us, but that time does allow for the person to perhaps process that information, think about what's been said, and then also, I guess, then think about their response back to the sentence or that simple instruction. So allowing time between statements, between sentences, between words, maybe for some, is really helpful and beneficial to the person living with a dementia. Don't argue. and again, not always easy, particularly if you've been perhaps on a 12-hour shift. It can be, again, we're human, but try your best not to argue. If the person says the sky is green, the sky is green. Just think about, okay, think about whether there's opportunity here to perhaps use some distraction techniques or other strategies that are going to be helpful, just to kind of move that conversation on, so you get away from, oh, the sky is definitely green, because again, that will cause the person to become more distressed. What do they use to do at this time of day? So, if perhaps it's say it's 3:30, maybe the particular person's becoming more unsettled. Is it because that's the time they'd normally go off and get the kids from school? Is that the time that they would normally go off to work? Is that the time that they would, pop and see their neighbours or friends? So again, it's really important to sort of know that life history as best as possible. And then thinking about, alternative therapies maybe, so aromatherapy. So the senses are really important for people with dementia. So hearing, seeing, tasting, smelling, touch. So a hand massage maybe. Or using some lavender smells, or again a scent that's meaningful to the person. I hate lavender, so please don't put lavender massage cream on my hands, but there will be scents that help a person, either through reminiscence, life history, which can be of great benefit. Music, massive one for people. I've mentioned Spice Girls, and I'm sure you've all got a singer, a band, or a particular song maybe that you often will put on if you're feeling gloomy, feeling upset, or feeling a bit annoyed just generally about the day. So you'll all have your go-to tracks. So personalized playlists can be really helpful. I've written mine down in my future plan, so my family know what music or particular songs that I'll want played for me. Simulated presence therapy, so that might be showing the person some videos of their family. It might be WhatsApp messages that they've previously received, or that are happening right now, bringing people sort of back. And again, thinking about those flowers, the petals of Kitwood's flower. So, that attachment, particularly, identity, particularly. But the more of those petals we can kind of hit, then the better the person is going to feel. Sometimes other distraction things, so fidget spinners, twiddle muffs, which I'm sure most of you have heard about, weighted blankets, maybe pets, doll therapy for some can be useful. Some, obviously again, it's thinking about the person, thinking about the life history, that conversation with the person, with their family, about what could we try, what should we give a go. And again, thinking about when the person with dementia, perhaps speech is quite limited, their understanding might be quite limited, but there are still ways to connect with the individual. So it might be going through old photographs of different periods. So for me, I was born in the early 80s, so probably my sort of early decade that I can really remember is probably the 90s. So looking back at the fashions of the 90s, music, television programs of the 90s, will be really beneficial to me. Dementia radio. So again, thinking about the era that's important, or that genre of music for the person that's more meaningful. Memory boxes. There's a really great example of one there. So again, person-centered things from the person's history. So the Harry Potter book there, so the Harry Potter books are really important to me. So I'd want a Harry Potter book in there. I'd probably want a Spice Girls album in there. I'd probably want my favorite teddy, which I've still got on my bed. So there'll be things that people have and they've collected over the years that remain really meaningful and could be really beneficial to the individual. Photo albums, really important, really helpful. We always encourage families to perhaps, create the photo album, but also ensure that people's names, are on there. So if the person is perhaps having difficulty remembering who might be in that picture, then staff can then say, oh, I think that's your Uncle Albert, or, whoever, just again to sort of hopefully sort of provide sort of more person-centered, more better support for the individual. So I mentioned some of these already. So the doll therapy, the twiddle muffs, but fixing things, regularly. When I do some work in a care home, there's a particular guy who was a carpenter. So he's forever turning up the table, wants to fix it, which is obviously really helpful, but can be quite distressing for other residents. So it's just thinking about how can we work with that for this individual in this environment. So with the slides that will be sent out to kind of all the resources that we've kind of touched on today, so you'll be able to click on those and gather more information. Some particular resources there around sundowning, and some other ideas, and then we also have a kind of a feedback form as well for when we complete training. So so thank you. I'm conscious of time. I've been checking it as we go through. I think
No, you're fine.
Thank you, Karen. So I'll stop sharing there. Does anyone have any questions or comments?
If I can just add one thing, if that's all right. Thank you so much, Steve. That was perfect. And I just was reflecting on like all of the speakers and what you guys you've all talked about how important it is to know the person that you're caring for. And I suppose from my side, being a non-clinical trained person, but someone who works with family carers every day, I'd say like, I know you all know this already and you probably already do it, but involving the family and getting to know the person must be so, so important. And so if that's something that I can support with by facilitating like family sessions or providing a welcome pack for your new families or webinars for your staff on like how like the right questions to ask, do let me know, because I can see the importance of that and that connection between the professional carer and the family carer. So yeah, just an additional thought, but thank you.
Thank you, Shad.
Thank you, Steve. That was very, very good. Thank you to Katja also. Does anybody have any questions? Oh, Andrew. Oh, somebody's coming in a bit late. What? Let me see. What's that question on the chat?
I have an answer for this, if that's helpful at all.
Yeah.
I don't know. I mean, I have a weighted blanket, and we've just bought it online. They're kind of like £50-ish, and it has to be at least 10% of the body weight of the person. Well, that's what they recommend anyway. But you can get them on Amazon or anywhere. They're really good.
Okay, that's great. Good to know. Thank you. Anybody else got any questions? Any burning questions? Put your hand up if you have. I took away a couple of things from there. 10-second rule. I think that's a really good sort of tip. Really, really good. Future plan. Everybody plans for their wills, their funerals and things like that. But future plan of, I guess that's assuming you're going to get dementia. Hopefully, let's hope you're not. But I guess it's quite a useful sort of thought process.
Yeah, it's really important. And, we did it with, my mum didn't have dementia, but we did it with my mum. So we documented all her favourite songs, her favourite poems, her favourite TV shows, just in case. Like I said, my mum didn't have dementia, but, when she was in her last sort of weeks of life, we were able, she couldn't then verbalise, so we were able to play her favourite songs. She did like lavender, so we were able to sort of massage lavender into her hands, so it's really, it's really important. Really important.
And we're not going to make any comments about you liking the Spice Girls. But, thank you. If nobody's got any further questions, I think today we've brought you 3 fantastic presentations and showing you different ways that you can help support your service users, help to train your staff, give them a better understanding of what they need to do, So I really thank our presenters today for their time. I know you're all very, very busy, and we do appreciate you giving up your valuable time. I'd also like to thank everybody for dialing in, and I hope you've taken away a lot from today's session. If you're listening to this on record, if you want to ask any questions, send me an email. And don't forget that we're not actually here at the time. Okay, so yeah, it just leaves me to say thank you very much, and I'm just going to stop sharing now. The recording. Sorry. Stop recording.